Well, good afternoon, everyone. Today we are reporting 17 new cases of COVID-19 in Saskatchewan. And sadly, we are also reporting one additional fatality, to which I want to express my deepest condolences to the friends and to the family on behalf of the province of Saskatchewan. Each and every death is a tragedy, and it is doubly hard at this time that loved ones are not able to gather together to grieve as they normally may. Today, almost all of the new cases are results of outbreaks in two parts of the province. One in Loche and the surrounding area, and two in Lloydminster, specifically the Lloydminster Hospital. A number of patients, as well as staff members, have now tested positive. And as you know, both the city of Lloydminster and its hospital are in a unique situation, as it is a city that straddles the border. The hospital serves patients both from Saskatchewan and from Alberta. It's staffed by health workers from both provinces. And the Saskatchewan Health Authority, together with Alberta Health Services, are taking a number of steps to deal with the outbreak at the Lloydminster Hospital. I'll ask Dr. Shahab and the Saskatchewan Health Authority officials to speak more about that in just a moment. With regards to the outbreak in the north, I have asked that more extensive testing be done in Loche and in the surrounding area. The Saskatchewan Health Authority is in the process of deploying 50 to 100 additional staff and the necessary materials to do aggressive surge testing and contact tracing in that community and in that region. Testing will focus on long-term care facility staff as well as residents, health center staff as well as patients, drive-through testing availability, door-to-door testing to known contacts, and anyone else who would like to be tested in the community of Loche will be tested. We need to identify positive cases as quickly as possible when we have outbreaks such as these. So those individuals would then be able to self-isolate and to receive medical care if required. The Saskatchewan Public Safety Agency and the Saskatchewan Health Authority are working with the community to ensure accommodation is available for anyone who may have difficulty in their own self-isolation plan. This will include using the two schools and portable trailers if needed. Currently, the plan is to have room for 65 individuals with the ability to scale up if required. Additional personal protection equipment has been sent to the community in the region of Loche, and the federal government is supplying 25,000 procedure masks as well as 25,000 pair of gloves to the region, and they were shipped this morning. Our government also continues to stay in contact with the Mayor of Loche and other northern leaders regarding the enforcement of the current travel restrictions and whether any changes need to be made to those restrictions. As a result of these two outbreaks, Phase 1 of the Reopen Saskatchewan plan will not begin in the community of Loche or in the community of Lloydminster on Monday as previously planned. We will still proceed with Phase 1 of the Reopen Saskatchewan plan throughout the rest of the province beginning this Monday. And I want to remind everyone that the first phase of the Reopen Saskatchewan plan is a very limited phase. A small number of previously restricted medical services will be allowed to open this coming Monday. Dentists, optometrists, opticians, physical therapists, occupational therapists, podiatrists, as well as chiropractors. That's the only change we are going to see in this province in the near term. Today, I have also extended the provincial state of emergency. This means that all the other orders that we have in place, all the other restrictions and guidelines, well, they remain in place for the foreseeable future. All other businesses not on the allowable list, they must remain closed for the time being. Businesses that are allowed to open must follow all of the physical distancing and cleaning guidelines to protect their employees and to protect their customers. All restrictions on travel, on large gatherings, and visiting our long-term care facilities, and to travel to and from northern Saskatchewan remain in effect. All of us must continue to follow safe physical distancing practices like we have over the past number of weeks. We must continue to limit our social interactions with people outside of our household to possibly one or maybe two other households. None of this has changed. Saskatchewan people have done so well in adhering to the public health orders put forward by Dr. Shahab and other recommendations, and for that I say thank you. It's the reason that we can cautiously begin the reopening phase next week. But all of these good practices, they must continue for it to be successful. If anyone is taking the Reopen Saskatchewan plan as a signal to relax your personal responsibility to maintain good physical distancing practices, that is a complete misinterpretation of what we have been saying. Good physical distancing practices, they need to continue. We must all do our part to continue flattening the curve and to continue in our controlling the spread of COVID-19. So I now ask Dr. Shahab for a few opening comments.
Thank you, Premier. So I'll start by also expressing my sympathy and condolences to the friends and family of the person who unfortunately passed away, the sixth death due to COVID-19 in Saskatchewan, and a reminder of why this is a serious illness and why we all have to do our part. I also wanted to speak a bit about, the total case numbers and recoveries are in the news release, but I just wanted to emphasize that as we stand today, if you look at central part of the province, Saskatoon, Regina, and the south part of the province, there are very few active cases. So the curve is absolutely flat, and we need to, as the Premier said, continue to practice all the things we've been doing, practicing physical distancing to keep the curve flat. The only change that's happened this week is that you can make a virtual household with one or two other families or one or two other friends, but stick to the same two households or two friends where you can, while maintaining physical distancing, maybe get together in a safe manner just to increase your sphere in terms of socialization. But it has to be the same two households, the same two friends. It can't be random mixing because that really would not be a safe thing to do at this point. But having said that, everything else said and done, the curve remains flat in the vast majority of the province. But of course, as the news release also said, there are 11 cases now from the far north, which are primarily from the Loche area, and of course 5 cases in the north, out of which 4 are from the Lloydminster area. So again, we have 2 settings where there is increasing concern. In the Loche area, of course, there's a community outbreak, which is there's a lot of effort being done to control that. And in Lloydminster, there have been ongoing cases in the community that have been managed just like everywhere else. But right now, there's a cluster of cases linked to the Lloydminster Hospital that, again, is being managed very effectively. But these, at the moment, are 2 localized clusters, and the rest of the province remains flat. And I think we just need to be mindful of that and make sure that we continue to do all the things that we have been doing to keep that curve flat while we cautiously reopen in Saskatchewan. So with that, I'll maybe ask Dr. Nsungu to maybe give a few opening comments about the Lloydminster situation, and then after that, I'll ask Dr. Rim Zayed to maybe give a few comments and update on the Loche situation, and then we can open it up for questions.
Thank you, Dr. Shahab. I would like to join the Premier and Dr. Shahab in extending my condolences to the families of our countrymates who have lost loved ones to COVID-19. As it was said before, we in the northwest part of the province are still experiencing high numbers of COVID-19 cases. In this particular situation of Lloydminster, since the season or since the outbreak started, we have recorded so far 30 cases of COVID-19 for the whole city of Lloydminster. The good thing is that out of those 34 patients who have been diagnosed with COVID-19, 18 have recovered so far, and 16 are still active. In the last few days, we have been dealing with a very challenging situation, as it was mentioned by the Premier and also by Dr. Shahab. A challenging situation associated with a number of cases where we can determine that transmission may have taken place or has taken place within Lloydminster Hospital. So far, we have identified 13 cases in total where we can say that transmission is associated with Lloydminster Hospital. And these 13 cases include 5 healthcare workers, and it includes also patients who are still admitted in the hospital, or some who have been discharged already, because in some cases the diagnosis was made actually after the patient had been discharged already, and this diagnosis was made through the contact tracing, because as part of what we are doing in managing this situation at the Lloydminster Hospital, we have a certain number of strategies, and vigorous contact tracing is one of those strategies. Besides that, we have also the proper use of PPE and the continuous coaching of healthcare workers in the use of PPE. Another strategy is to cohort the patients to one area of the hospital. It is important to know here that Lloydminster Hospital is one of the designated COVID-19 hospitals, and not only COVID-19 hospitals, but also COVID obstetrical hospital. So in that situation, the cohorting of patients, especially now that we're at the cluster, is extremely important. The daily monitoring of the situation and adjusting as we go is another strategy. And you must have learned recently that all healthcare workers are asked to screen or to be screened every day before they assume duty. And this is something that we are enforcing diligently, especially in this situation where we are dealing with this cluster. A decision that we made very recently is to limit the admission of patients to Lloydminster Hospital. I say that the essential services like the emergency room services, emergency surgical services, obstetrical services, all those essential services will remain open, but the admissions will be limited for the time being to COVID-19 patients, and patients who do not have signs suggestive of COVID-19 may be asked to be admitted somewhere else in another hospital. Of course, the patients in that situation will not be left on their own. The system will be there to assist them in finding a place where they can be admitted. I will stop here, and thank you very much, Premier and Dr. Shahab.
Thank you, Dr. Nsungu, for that update. And now I'll ask Dr. Rimzai to provide an update on the situation in Loche, please.
Good afternoon, everyone. I first like to extend my deepest sympathies to the family of our most recent COVID death, along with the entire community. We have, for now, 38 confirmed cases in Loche, and another 11 cases in nearby communities, which are related also to the Loche situation. We have an immediate a plan for the as we continue in our plan for slowing the community interaction and restricting community mobility. Also increasing the number of people tested in the community by expanding testing sites. Now we have the gene expert machine in Loche, and we expand the testing criteria to include more people compatible who are compatible for testing, and testing is prioritized, and we have now increasing our capacity so that we have no limitation for testing and contact tracing. In the same time, there is also more working with the community leadership and the community of Loche for providing the alternative confinement in case of places where there is no feasibility for appropriate isolation. We have a very good strategic plan for increasing the capacity, and we are working together on this outbreak to contain outbreak with our partners in the community and our partners in the Northern Intertribal Health Authority. And I want to thank also the staff for their hard work for contact tracing and testing, and I want to thank my colleagues in Saskatchewan Health Authority for how we are working together in increasing the capacity and improving the situation for Loche and the other northern communities. Also, I want to thank the leadership in Loche and Clearwater River for their assistance in reaching out the communities as we work to stop the spread of the virus. We are committed to continue to look at how we can help patients and how we can help the community, and especially people who are tested positive or suspected to have COVID-19 to self-isolate. We know that it is difficult and challenging, but we are really appreciating the support that we get from the community, from the leadership, and and we thank everyone for their efforts. It's really our work, working together, and it has been a great experience for everyone, trying to limit this infection and prevent it, and we will be able to do that. Thank you.
Thank you to the doctors on the line. We'll now take questions, and just a note for those on the line, for any questions of a general nature to the Saskatchewan Health Authority, we also have Scott Livingstone on the line, CEO of the SHA. We'll go to our first question from the line, operator.
We have Phil Tank with the Star Phoenix.
Yeah, I'd like to know when you became aware of the outbreak in the Lloydminster Hospital. Did it have to rise above 10 cases before you considered it a cluster? And how did it, everything basically you know about how that proceeded?
I became aware of it this morning, but Scott Livingston, you may have something to add there.
Thanks, Premier. I think Dr. Nasungu would probably be in the best position, as he's been on the ground on a day-to-day basis. But we have been aware, as has already been reported out through Dr. Nasungu, there have been a number of cases in the Lloydminster area, and as he's also pointed out, many of those have recovered. This cluster inside the facility is one of concern, but one in which Dr. Nasungu has been managing on a day-to-day basis, so I would ask him if he had any specific comments about it.
Yes, we are talking about it today with the media, but it is not to say that it is only now that the problem has been identified. It is not to say that it is not only now that the action has taken place. When we realized that there was a very first transmission, we started discussion already with the hospital management, and already at that time action was put in place action that is tailored to just one or two cases. And the situation has been monitored on a daily basis. Today we are at 13 cases, but I must say that yesterday alone there were 5 cases. And by that time, we had already declared the outbreak, because the outbreak was declared to the Ministry of Health as the communicable disease regulations. It was already declared to the Ministry of Health on Sunday. So, and then yesterday, we had 5 cases in one day, and today, so far, we have 1 case. So, once again, we are talking about it publicly, the media today, but the problem has been followed up since it started, and action has been put in place. All that we are doing now is to continue readjusting that action.
Do you have a follow-up, Phil?
Yeah, I guess I wonder, was it any particular part of the hospital, and why not come out earlier, letting people in Lloydminster know about it, so they could make decisions about whether they, have something minor and maybe don't want to go to the hospital with it?
As it is with any other similar situation, you put in place measures to control the situation, and the hope is always that you will control the situation, because there is also a balance between sending an alarm to the community too soon, and you have to balance that with the, let's say, the negative impact that may result maybe in terms of panic. So you have to find the right time to make that announcement in such a way that you actually do not panic the population overly for not much benefit.
We'll take our next question from the room here. Steph?
Yeah, for the Premier, we've seen that there is a travel restriction heading into the far north, but there's nothing stopping people who are in Lloydminster from traveling elsewhere in Saskatchewan. So what are you going to do about that, and why is there no announcement today of stricter travel restrictions to, say, Alberta and Saskatchewan?
The outbreak in Lloydminster is, to this point, in large part confined to the one source that's in the hospital, and we are working our way through how we can ensure that we confine that to that hospital and those individuals that have been in touch with those people that have tested positive in the hospital. So we've expanded our testing in that specific area with respect to patients, with respect to staff, with respect to families, people that have been through the hospital over the last number of days, to ensure that we can identify all of those that are positive and those that have been in touch with those that are positive, isolate them and isolate this so that it does not become a provincial issue. If it continues to grow, that may be a conversation that we may have.
Follow-up, Steph?
Yeah, you mentioned talking to the Loche's mayor and the issue of travel restrictions came out. Can you expand a little bit more on what you've discussed with him, maybe what you're considering as a next step on that one?
As a next step, the Minister of Government Relations is actually on a call, I believe, at the moment with all of the northern leaders from the communities, and she'll be following up with those from Aboriginal communities, their Indigenous communities throughout the north, on exactly where should we continue with travel restrictions in the north. Are there areas where those can be relaxed? And the conversation specific to the Loche region is how can we actually enhance the protection that we have in that particular area. So there'll be more to come, likely within the next 24 to 48 hours on what the longer term travel restrictions will look like in the north, but they very well may relax in some areas where we do not have a large number of positive cases at this point in time, but they very well may be enhanced in some areas in and around the Loche area.
We'll take our next question from the phone line, operator.
We have Guy Quinville with CBC.
Thank you. Your surge plan called for Lloydminster. Oh, can you hear me?
Yes.
Yeah. Your surge plan called for Lloydminster Hospital to have a mix of COVID and non-COVID patients. And in today's release, it says that as of today, patients are now being cohorted in separate units of the hospital. So my question is, had you been mixing COVID patients and non-COVID patients at that hospital for how long? And do you believe that's what caused this cluster?
Dr. Nasungu, could you maybe answer that, and then Scott Livingston can also add to that?
Yes, the first thing to remind everybody about is that in the situation of COVID-19, most of the times you will actually realize that you are dealing with COVID-19 in retrospect, because you cannot, you know that the signs of COVID-19 can be similar to those of other diseases, especially viral disease. So until you have that positive result, there is no way you can say that you are dealing with COVID-19. So that is a way to say that in most cases, you know, you are looking at the situation actually retrospectively. That's one thing. The second thing is that once you know that you have a COVID patient, we don't put them actually in the same room than other patients. They are on their own. They must be in an isolated room. But what we're saying is that for the time being, the whole medical flow will be only for the COVID patients. So that's the only nuance that I want to bring up here.
Mr. Livingston, do you have anything to add on that?
Only that I think to Dr. Masungu's point is that, and I believe this is what he was what he was saying, is that if we have inpatients in a facility that are COVID specific, they would be under individual isolation requirements with PPE requirements for all staff going in and out and working with them. However, if there was a patient inside the facility in another area that we didn't know had COVID, that would be why you may see them separate. But at this, you know, it is the full intention as through our surge plan to have patients cohorted by ward where we can. But again, to Dr. Osungu's point, is we need to know for sure that they are infected and exhibiting symptoms, and that's not always the case.
Do you have a follow-up, Guy?
Yes, thank you. I'm going to pivot now to Loche. Can you say whether the sixth person in this province to die in connection with COVID-19 was a resident or patient of the Loche Health Center? I'm not asking for the name. I just want to know if they were a patient or resident of that facility.
It is, as you know, the second patient was a long-term care facility patient. Yes. For that particular disease, it is affecting the vulnerable population. So any person with especially for aged group and with frailty or fragility or being really vulnerable in terms of their health. So this will be a very challenging situation.
We'll take our next question from the phone line, operator.
We have Mark Smith with CTV.
I'm just wondering about the ramping up of testing in the Loche. How is that going to work? And what numbers are we kind of looking at for testing? Are we going to test the entire town of Loche? How is it going to work?
I'll just say one opening comment, and then Dr. or Scott Livingston, you'd follow up. But I would just say this. If there are people in Loche that would like to be tested, they will have the opportunity to be tested. We won't be forcing people to be tested, but we are asking them to be tested, and we have the resources to test, if need be, the entire community. Scott?
So just to follow up on the Premier's point is we have already been aggressively testing, and as Dr. Zayed has already pointed out, we are testing in more than one location already in the Loche, including the home visit testing, so we're actually going to people's homes. And to the Premier's point, we will continue to expand that testing. Again, we're not going to force people to have testing, and there are still people, inside the Loche that are in self-isolation that we will get to that were maybe contacts of other folks. And as we have always talked about the strategy on the offensive side, it involves aggressive testing, very aggressive contact tracing, which Dr. Zayed has already spoken to, which is already on the ground there, and we will be putting more resources in the ground in the Loche to support that. But the third leg of that stool, which is just as important to contain the virus and break the chain of infection, is the adherence to isolation and social distancing and all those other things that have gotten us where we are today in the southern part of the province. And as you've already heard today from Dr. Zayed, we are aggressively pursuing with the Saskatchewan Safety Association how to support people in the Loche to be able to meet that need of self-isolation and social distancing.
Do you have a follow-up, Mark?
Yes, this has to do with phase 2 of the reopen plan. There's a lot of concern from businesses that are a part of that phase that they won't have the access to PPE and cleaning products and the finances to cover the cost of buying that. Will the government be supporting those businesses with the cost of PPE in any way?
So the personal protection equipment that we haven't looked at supporting the cost at this point in time. The personal protection equipment that the government has, we are reserving for our medical staff to use in our healthcare system, of which we will and quite likely need all, if not at least most of it in the days ahead. So we do not have personal protection equipment at this point in time to make available to the retail sector, if you will, and to the private sector. We have said since the beginning there may be some challenges in accessing personal protective equipment. I've heard less challenging to access cleaning supplies. However, they may be there as well, and that may hinder some of this reopening plan. And so we will work with private industry where we can in sourcing personal protection equipment, but the stocks that we have provincially, and we're fortunate to have what we do have, need to be utilized in our healthcare systems.
We'll take our next question from the phone line, operator.
We have Murray Mandrick with the Leader Post.
Good morning, good afternoon, Mr. Premier. Follow up to Stephanie's question. Given that Alberta is having cases at a rate 10 times ours, and given the close proximity of the province, particularly as it's interconnected socially and otherwise, with the long weekend coming, why are we not looking at further travel restrictions for people in Alberta coming to camp, coming to do other things? Why not look at something like a 2-week isolation period going back and forth if it's becoming as large a problem in certain areas as it is?
That is one of the items that is under discussion, in particular in our communities in the northwestern part of the province. This is one of the items as to why we held off even the consideration of overnight campgrounds being available for the May long weekend, was to provide us with that extra 10 days or so of just not attracting people to Saskatchewan from all other areas of Canada. This is no time to be traveling interprovincially unless it is for absolutely essential need. Dr. Shahab has a recommendation against traveling interprovincially. We have not elevated that to a mandatory self-isolation at this point in time, as I'm unaware of any province that has done that, possibly Manitoba. I'm just a little uncertain at this point in time. I know they were informing people to that they should consider self-isolation or should not consider interprovincial travel at the border actively with people on the ground. So we have actually discussed and continue to discuss those options in the days ahead, but there should, with the overnight camping not being available here in Saskatchewan, it is our hope that that would restrict some of that activity. It's also our hope that people would adhere to the recommendation by Dr. Shahab and not travel interprovincially for recreation purposes.
A follow-up, Murray?
It's sort of a separate question, or it is a separate question. With the rejection of by Unifor of the FCL latest contract offer, is there any thought to recalling the legislature to legislate a binding agreement, sir?
Well, if that was to be done, that would be unprecedented in the province's history, and I'm aware of very few cases, if any, across Canada where that has actually occurred. This is a private sector labor dispute that is occurring, and my understanding at this point in time is we just learned that there was the rejection of the final offer by Unifor to the FCL, that the minister has been reaching out to both sides to have a discussion with respect to what the next steps are from their perspective.
We'll take our next question from the phone line, operator.
We have Lisa Schick with CJME.
Hi. My question is about the public health orders, people social distancing and kind of isolating themselves in their homes. We're hearing that a lot of people we're several weeks in, they're kind of sick of it, I guess. Do you expect that people are going to continue to do this in the weeks ahead? And what do you say to people who are sick of it?
Well, it would be our hopes that people do continue to keep a safe distance, do continue to practice, using hand sanitizer, keeping your hands clean, not touching your face with your hands, practicing all of the things that have, quite frankly, flattened the curve in virtually all parts of the province over the course of the last while. And Dr. Shahab, you may have something to add, but I understand the frustration with having a little bit of cabin fever, if you will, and that is why we have tried to be very methodical with our conversation around not just reopening portions and sectors of the Saskatchewan economy, but trying to reopen some of those activities, whether it be some of the provincial and regional parks in the province, whether it be some of the golf courses, whether it be just providing some access for people to get outside and enjoy the weather that we're having, and no better example of the weather that's out there today. It's a beautiful spring day. That is why we had the discussion, I guess it would be last week, with respect to, we can expand our household a little bit, but we need to be very careful with how we expand our circle of contact, if you will. And so I know it's been a long time to be practicing physical distancing, staying in your home unless absolutely necessary. And we want people to get outside and enjoy what all that the Saskatchewan spring and summer have to offer. But we certainly want them to do it safely, and safely not only for them and their family, but safely for all Saskatchewan people. Dr. Shahab, anything to add to that?
Yeah, so I'll just maybe speak to it a bit more, because I think we've said many times before that for the next little while, there's no going back to business as usual. We all have to live, work, and play in the new normal. And what that means is that, we have to accept that how we can do that in a way that, we can thrive in the new normal in a way that keeps us safe and keeps our transmission risk low. So what that means is that if you can work from home, you have to work from home, and that may be a significant adjustment for some in terms of children are also out of school and at home. When you can safely enjoy the outdoors as a household, you can, and we all see many people doing that in a very safe and responsible way. There is now the opportunity to connect with one or two friends outside of your household, or to connect with one or two households outside of your household, not so much in situations where there are current outbreaks, which could include parts of Lloydminster or Loche, but in other settings you can now cautiously do that, but it is connecting with just one or two friends or one or two households, just to expand your circle in terms of a virtual household. But having said that, we still, when we go out shopping, we still have to practice our physical distancing. When we work in essential services, we still have to use all the precautions, whether it's physical distancing or when you have to get closer than 2 meters PPE. And I think the current outbreak in a health facility in Lloydminster Hospital, the current outbreak in the community setting in Loche, the unfortunate 2 deaths that we've had recently in a long-term care setting are all stark reminders that, if we let our guard down, this COVID-19 comes back very quickly.
You have a follow-up, Lisa?
Yes, I actually have a separate question for the Premier. Saskatchewan have been doing very well the last few weeks. New cases in the single digits, no deaths for a fair bit. And then just in the last few days here, we're getting cases up and above 10 in a few days and 2 deaths in a short period of time. We're kind of on the eve of things starting to reopen. So what's your reaction to this? How are you feeling?
I would say in general, 2 things. In general, Saskatchewan, the vast number of communities in Saskatchewan continue to do well. We have 2 very isolated but significant outbreaks, one in the northwestern area of Loche and one in a facility in Lloydminster, in the hospital facility there with some patients and some staff. We have said all along there will be these isolated outbreaks, and we need to utilize the testing capacity that we have worked hard to gain. We need to utilize the contact tracing capacity that we have, and we need to ensure that we then put into action significant opportunities and plans for isolation and supporting that self-isolation in those communities. And so we are working very hard in both of these instances to ensure that those supports are provided, given very different outbreaks and very different communities, quite frankly, one being in the far north and one being a border community, 2 very different communities and different from other communities in the province as well. So we feel quite confident with respect to phase 1 of our reopening plan moving forward. It is a phase that involves a number of medical services that otherwise would be provided here in the province. We feel confident that we have had a number of businesses that have been open all along throughout this essential service, providing essential services to our communities all along throughout the course of the past month. And we have been able to flatten the curve by and large right across the province. So we're confident that we can do so in these 2 isolated outbreaks. We're working very hard to ensure that is the case. And we'll continue on the path that we're on. We, despite these 2 isolated outbreaks, we're confident that by and large Saskatchewan is doing very well. And I think when you compare our overall numbers to other provinces, that is the case. This is very different than if we had an increasing of 10 to 17 and then maybe continue going across the province, and we were unaware of exactly where those sources were. So this is explainable. These are isolated outbreaks that we are well poised to deal with, and we're making every effort to ensure we do that with the communities involved. Dr. Shahab, anything to add on that?
Yeah, and I'll just add that, we look at the numbers of cases, we look at where they are they linked to an outbreak in a facility like Lloydminster? And we have to remember that while the Loche issue is concerning and alarming and a lot of effort is being done, when you do aggressive testing, most of the people you are testing have either no symptoms or mild symptoms that would not themselves have come forward for testing. So by doing aggressive testing, the case numbers rise quickly, but that's really a good thing because you're doing aggressive case fighting to get ahead of the outbreak and control it. So I think we need to keep those things in perspective. But at the same time, these are all, I think, reminders for us that how quickly COVID-19 can come back. Even though the curve is flat, if you let your guard down as an individual, as a family, as a community, it comes back with a vengeance. And so we have to continue to do the things we've been doing as we cautiously reopen.
We'll take our next question from the phone line, operator.
We have Dan Jones with MBC.
Yeah, good afternoon. This question is for Dr. Zayed. In terms of the 50 to 100 additional staff to be brought into Loche to do the surge testing and contact tracing, when do you expect those staff members to be on the ground? And of these 65 isolation beds that have been identified in that community, how many are currently occupied?
So in terms of the staff we have a continuous meetings about that, and there is an immediate deployment of some of the staff started actually from tomorrow. We need more people, of course, to have boots on the ground in the Loche, people who have the language, also the Dene language. So we are really having a very good plan for now, and we are starting, I can say, from tomorrow there will be more support for the capacity, and the plan is really first of all, we started already with the increased testing and expanding the testing side by establishing the gene expert machine, so that this is by itself saving the courier time. And to have the rapid testing is by itself an achievement. In addition to that, we already started the system this approach for active case finding from the beginning of the outbreak, and now in a matter of days we'll start this door-to-door. Actually, we started now with the mobile unit, but it will be more aggressive in a matter of a couple of days, hopefully, to have these door-to-door finding cases. And it is not only about finding cases and test them, it's about also the risk assessment, doing the risk assessment if this house is not feasible for isolation, and immediately working, like we have already established the community working, community collaboration. So immediately we can collaborate with the EOC, Emergency Operations Center, related to the community, and we can isolate if this is not feasible in the house, to transfer the person who have symptoms, or even some if we find some vulnerable population who want to protect due to age, or we want them not to be exposed. So this is also can be available, and we are on a daily discussion and communication with the community leadership and people working as coordinator in the community. So there is a lot of work already started, and there is an urgency to start from tomorrow. And I think by the weekend we will have like a complete capacity in terms of this aggressive plan.
Do you have a follow-up, Dan?
Yeah, just sorry, the second part of that question was how many of the 65 beds you've identified have been filled?
Sorry, can you clarify again, the 65?
Yeah, the Premier said there are 65 beds or 65 available units that have been identified for isolation. How many of those units are being currently occupied?
I am not aware about the number of occupancy because this is run by the community. But when there is more places, and I think according to what my recent information, that there have been around 12 people who are occupying this isolation beds, and in the same time, some people who end their 14 days, they are released from the isolation as well. Some people also use it for a temporary time, so it's not the whole time until they have the results. The results. So it's like it's a continuous use of these facilities.
Yeah, and I would just maybe add to that some clarification. I think we have some Sask housing units in the community that we have offered to the community to fill up first. We have some housing that we have for educators that isn't being utilized at the moment as well. We've offered that to the community. I believe, I don't know the numbers, but I believe there are a number of people in those units. And then as well as we have for a short-term capacity addition, if you will, or setting up those 65 beds in the school so that if there are positive individuals, a number of them that need the opportunity to self-isolate, or people that just need the opportunity to self-isolate, we do have that capacity in the schools, and then we are looking at, is there some opportunities for us to use some mobile trailers and bring that into the area as well. So there's really a three-phased approach there that we are looking at. The 65 beds I was referring to were the beds that we are moving into the actual school, but we do have some housing space that we are utilizing in the community today.
We'll take our next question from the phone line, operator.
We have Roberta Bell with Global.
Hi, I was just wondering if you could clarify whether or not the sixth person to die was actually living in the long-term care home, and that's actually where they died, was in the long-term care home, actually in the Loche. And regardless, how many active cases are still associated with the long-term care home in the Loche? How many residents there are sick?
For the patient who has been who was deceased in the Loche, the person was yes in the long-term care, and we had a discussion with the family where there was before the patient was before the patient passed away. In terms of how many other cases, we have one other person, and she is the person is stable, completely stable, and recovering. The other residents are negative, and we are monitoring them, as I mentioned before, every day. As I also emphasize, this is a disease that affects vulnerable population, and it's unpredictable how the situation can really end or complicate. That's why we are always monitoring them very closely.
You have a follow-up, Roberta?
And just on another note, I saw that the Northern Village of Loche has implemented a community lockdown starting on Friday, and I was just wondering if this is related to that community now grappling with an active COVID-19 case.
Dr. Zayed?
So as a measure that we are taking, and it's one of the most aggressive measures, as I mentioned also, that contact tracing is something that will direct our work. So when we find that the movement between community or community mobility will add to any added risk, so in that situation, we advise and with consultation with the communities. I think today there was as the Premier mentioned, there was a meeting with the Minister of Government Relations, and this allows to the community, if they want to lock down. And I can talk about La Loche specifically. So this is something that we support in terms of slowing the community interaction and restricting community mobility and travel. We think that this decision would be helpful, and this is also a restriction is done, and this is an understanding among the northwestern municipalities. If they opted to do this decision or order, it is a restriction that must be done in a way that allows essential service to function and reach the community while restricting non-essential travel. But again, it's one of the measures that sometimes you have to take to restrict, to slow the community interaction in this aggressive disease that is really spread by more community interaction and mobility.
And we'll take our last question from the room. Steph?
Yeah, for the Premier. You've already had to remind people that there's no mass gatherings and to clarify to not get together in more than groups of 10, and we're not even in the actual reopen plan yet. So does this give you pause to think as evidence that people may not actually just listen and respect the public health advice that you're still going to be given as these restrictions start to get clawed back?
No, our numbers here in this province actually speak to otherwise. Yes, there are isolated incidents where people may be gathering or may, inadvertently or intentionally, not adhere to the recommendations or actually the restrictions that are put in place. But by far and away, the vast majority of communities, of people, of individuals are taking that individual responsibility very, very seriously, and it shows in our numbers. We have in this province 70% below the national average of infection rate per capita. We are doing that well with 40% above the national average testing. So we are testing more, and we have a much lower infection rate here in Saskatchewan, and that is in a large part because of the physical distancing that the vast majority of the people of this province are performing. We also are getting a snapshot view, if you will, with a few isolated instances of just how contagious this disease can be. We have in Loche a number of cases. We have inadvertently in a facility, in a hospital facility in Lloydminster, a cluster or an outbreak in that facility. So this is nothing for us to fool with, and I think we have been taking it very seriously, and I would just urge all Saskatchewan residents to continue to take it very seriously. Our collective success is only due to the high degree of personal responsibility that we have put on each of us, and it's my true hope that that continues, because it's the only way that we're going to be able to phase in our Reopen Saskatchewan plan.
Follow-up, Steph?
I mean, you credit Saskatchewan people a lot. I think our sparse population might have something to do with the rate of its spread, but this started to slow once these very stringent and strict public health orders were put into place. We've never seen a situation where this has slowed and people are allowed to interact close to what they used to be able to, or more than they are now. So shouldn't this evidence of people disrespecting your words and the words of Dr. Shahab give you pause to think, we're giving people a little and they might end up taking a lot?
No, I have faith in the people of this province that they will not take a lot. They will take this very seriously. They'll adhere to the restrictions that Dr. Shahab puts forward. And as you see, as we're managing these two localized outbreaks, where we need to stiffen up some of the restrictions with respect to a specific area, we're doing that. Where we need to provide additional supports with respect to a specific area, we're doing that. So we will deal with these isolated outbreaks as they arise, but by far and away, and it's my belief that the vast majority of the people of this province are doing exactly what they need to be doing, and it's my expectation and my belief that they'll continue to do that in the weeks ahead, because they truly do want to see things not go back to normal, but go to a new normal, if you will. And the normal that we are heading for is very, very different than where we were just 2 months ago.
Thanks very much for joining us today, everyone. That concludes our time.